Question 1. The control framework reveals that a certified transplant nurse is responsible for screening a post-kidney transplant patient for complications. Which of the following approaches best reflects the comprehensive and proactive screening required for infection, rejection, and malignancy in this population? Option A. Regularly assessing for fever and general malaise, and inquiring about any new lumps or skin changes, while relying on the transplant team for specific diagnostic workups. Option B. Monitoring vital signs at scheduled intervals and only escalating concerns if the patient reports severe, acute symptoms such as high fever or significant bleeding. Option C. Primarily focusing on the patient's reported pain levels and ensuring adequate pain management, as this is often the most significant concern for post-transplant patients. Option D. Conducting a thorough physical examination, reviewing recent laboratory results for trends in organ function and inflammatory markers, and eliciting detailed patient reports of any new or worsening symptoms, including subtle changes in appetite, energy levels, or urinary output. Correct answer is A. Regularly assessing for fever and general malaise, and inquiring about any new lumps or skin changes, while relying on the transplant team for specific diagnostic workups. Explanation. The control framework reveals that post-transplant care for a certified transplant nurse involves vigilant screening for complications, particularly infection, rejection, and malignancy. This scenario is professionally challenging because these complications can manifest subtly, overlap in their early signs, and require a nuanced understanding of the patient's individual risk factors, transplant type, and immunosuppression regimen. The nurse must integrate clinical assessment, laboratory data, and patient history to identify potential issues promptly and accurately, balancing the need for early intervention with the risk of over-investigation and patient anxiety. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized, and evidence-based screening strategy. This aligns with the ethical imperative to provide competent and patient-centered care, ensuring that all potential complications are considered based on established protocols and the patient's unique clinical picture. Regulatory guidelines for transplant nursing emphasize proactive monitoring and timely reporting of concerning findings to the transplant team, thereby minimizing morbidity and mortality associated with these serious post-transplant sequelae. An incorrect approach that relies solely on routine, nonspecific symptom checks fails to acknowledge the specific risks associated with immunosuppression and organ transplantation. This neglects the regulatory requirement for specialized knowledge and skills in transplant care, potentially leading to delayed diagnosis of critical conditions like opportunistic infections or acute rejection. Another incorrect approach that focuses only on overt signs of infection overlooks the insidious nature of early rejection or the development of post-transplant lymphoproliferative disorders, PTLD, which may present with nonspecific symptoms. This demonstrates a failure to adhere to the comprehensive screening mandates within the transplant nursing scope of practice. A third incorrect approach that prioritizes patient comfort over diligent screening, without clear justification or team consultation, would violate the professional duty to advocate for the patient's well-being and could lead to significant adverse outcomes, contravening ethical standards of care. Professional decision-making in similar situations requires a systematic process. First, thoroughly assessing the patient's baseline status and known risk factors. Second, applying knowledge of common and rare post-transplant complications and their typical presentations. Third, utilizing diagnostic tools and interpreting results in the context of the patient's overall condition. And fourth, collaborating effectively with the multidisciplinary transplant team to ensure timely and appropriate management. This iterative process of assessment, intervention, and evaluation is fundamental to providing safe and effective transplant nursing care. Question 2. Market research demonstrates that patients often struggle with the complexity of post-transplant care regimens. A recent kidney transplant recipient, Mr. Smith, appears overwhelmed when discussing his daily immunosuppressant medications, dietary restrictions, and the importance of regular laboratory monitoring. He has a history of limited formal education and expresses anxiety about managing his new health responsibilities. As the transplant nurse, what is the most appropriate approach to ensure Mr. Smith's understanding and adherence to his post-transplant care plan? Option A. Provide Mr. Smith with a detailed written manual outlining all aspects of his care and schedule a follow-up appointment in 1 week to address any questions he may have. Option B. Conduct a series of short, interactive teaching sessions over several days, using simple language, visual aids, and teach-back methods to confirm understanding of medication schedules, dietary guidelines, and follow-up appointments, involving his wife with his consent. Option C. Assume Mr. Smith will absorb the necessary information through osmosis and focus on his immediate physical recovery, deferring detailed education until his first post-transplant clinic visit. Option D. Briefly review the medication list with Mr. Smith, highlighting the critical times for each dose, and instruct him to contact the transplant coordinator if he has any concerns after discharge. The correct answer is A. Provide Mr. Smith with a detailed written manual outlining all aspects of his care and schedule a follow-up appointment in 1 week to address any questions he may have. Explanation. Scenario analysis. This scenario presents a common challenge in transplant nursing where a patient's understanding of their post-transplant care regimen is incomplete, potentially jeopardizing graft survival and patient well-being. The challenge lies in ensuring the patient can independently and accurately manage complex medication schedules, dietary restrictions, and follow-up appointments, all critical for long-term transplant success. The nurse must balance the need for comprehensive education with the patient's capacity to absorb and retain information, especially given the emotional and physical stress of a recent transplant. Correct approach analysis. The most effective approach involves a multifaceted, patient-centered education strategy. This includes breaking down complex information into manageable segments, utilizing various teaching methods, verbal, written, visual aids, and actively assessing the patient's comprehension through teach-back methods. Reinforcing education at multiple touchpoints, involving family members or support persons with the patient's consent, and coordinating with the multidisciplinary transplant team, pharmacists, dietitians, social workers, are crucial. This aligns with the ethical principle of patient autonomy, ensuring informed consent and the patient's ability to participate actively in their care. Regulatory frameworks emphasize patient education as a cornerstone of safe and effective healthcare, particularly in complex post-transplant management, where adherence is paramount for preventing rejection and complications. Incorrect approaches analysis. One incorrect approach would be to solely rely on providing a written information packet and assuming the patient will read and understand it independently. This fails to account for potential literacy barriers, cognitive overload, or the patient's current physical and emotional state. Ethically, this approach neglects the nurse's duty to ensure comprehension and can lead to non-adherence, violating the principle of beneficence. Regulatory guidelines mandate active patient education, not passive information dissemination. Another incorrect approach is to provide a brief verbal overview of the medication regimen without assessing understanding or offering opportunities for questions. This is insufficient for a complex immunosuppression schedule and carries a high risk of medication errors or missed doses. It demonstrates a failure to meet the standard of care for patient education, potentially leading to adverse patient outcomes and violating regulatory requirements for patient safety. A third incorrect approach would be to postpone comprehensive education until the patient is discharged, assuming they will receive adequate instruction from their primary care physician. Transplant care is highly specialized, and the immediate post-transplant period is critical for establishing adherence. Delaying education shifts responsibility inappropriately and fails to address the immediate needs and potential knowledge gaps of the transplant recipient, which is a breach of professional responsibility and regulatory expectations for specialized care. Professional reasoning. Professionals should employ a systematic approach to patient education. This begins with an initial assessment of the patient's learning needs, preferences, and readiness. Education should then be delivered in a clear, concise, and culturally sensitive manner, using a variety of methods. Crucially, comprehension must be verified through teach-back or other interactive methods. Ongoing reinforcement and opportunities for questions are essential. Collaboration with the entire transplant team ensures a holistic approach to patient care and education, addressing all aspects of post-transplant management. This iterative process of teaching, assessing, and reinforcing is fundamental to empowering patients and ensuring optimal outcomes. Question 3. The efficiency study reveals that a significant number of potential transplant recipients are not fully engaging with post-transplant psychosocial support services, leading to suboptimal adherence and increased readmission rates. A nurse is caring for a patient who has repeatedly declined referrals to the transplant social worker and mental health counselor, stating they don't need that kind of help. The patient's family, however, is expressing strong concerns about the patient's emotional state and is urging the nurse to ensure the patient attends these appointments. What is the most appropriate course of action for the transplant nurse to take? Option A. Respect the patient's stated refusal of services and document their decision, informing the family that the patient has declined support and that their wishes will be honored. Option B. Contact the transplant social worker and mental health counselor directly, providing them with the family's concerns and requesting they reach out to the patient to schedule appointments, overriding the patient's initial refusal. Option C. Schedule an immediate meeting with the patient and their family to discuss the importance of psychosocial support and the potential risks of non-adherence, emphasizing the family's concerns. Option D. Initiate a private, one-on-one conversation with the patient to explore their reasons for declining support, assess their current psychosocial status, and collaboratively discuss available options and the benefits of engagement. The correct answer is C. Schedule an immediate meeting with the patient and their family to discuss the importance of psychosocial support and the potential risks of non-adherence, emphasizing the family's concerns. Explanation: this scenario is professionally challenging because it requires the transplant nurse to navigate a complex interplay of patient autonomy, family dynamics, and the ethical imperative to provide comprehensive psychosocial support, all within the strict regulatory framework governing transplant care. The patient's reluctance to engage with support services, coupled with the family's perceived urgency, creates a delicate balance. Careful judgment is required to respect the patient's right to self-determination, while ensuring they are fully informed of available resources and potential consequences of non-engagement. The correct approach represents best professional practice because it prioritizes patient-centered care and adheres to the ethical principles of beneficence and non-maleficence. By initiating a private, open-ended conversation with the patient, the nurse respects their autonomy and creates a safe space for them to express their concerns and readiness for support. This aligns with regulatory guidelines that mandate informed consent and patient-centered decision-making in healthcare. Furthermore, it allows the nurse to conduct a thorough psychosocial assessment, identifying specific barriers to engagement and tailoring support accordingly, which is a cornerstone of comprehensive transplant care. An incorrect approach that involves immediately involving the family in a discussion about the patient's reluctance without the patient's explicit consent would be a significant ethical and regulatory failure. This breaches patient confidentiality and autonomy, potentially eroding trust and creating further resistance. It also bypasses the nurse's responsibility to conduct an independent assessment of the patient's psychosocial needs. Another incorrect approach, such as dismissing the patient's concerns and proceeding with mandatory referrals, disregards the patient's right to refuse services and fails to acknowledge the potential underlying reasons for their reluctance, which could be rooted in fear, misunderstanding, or cultural beliefs. This approach is not only ethically unsound, but also likely to be ineffective in achieving positive patient outcomes. Professional decision-making in similar situations should involve a systematic process. First, assess the immediate situation and identify the core conflict. Second, consult relevant professional ethical codes and regulatory guidelines to understand the legal and ethical boundaries. Third, prioritize patient autonomy and confidentiality while actively seeking to understand the patient's perspective. Fourth, engage in open and empathetic communication to build rapport and gather information. Fifth, collaboratively develop a plan of care that respects the patient's wishes while ensuring they have access to necessary support and information. Finally, document all assessments, interventions, and patient decisions thoroughly. Question 4. Process analysis reveals that a post-kidney transplant patient, 10 days post-operative, presents with a slight but sustained increase in serum creatinine from baseline and reports mild flank discomfort. Which of the following approaches best reflects the immediate nursing priority in monitoring for potential rejection? Option A. Focus solely on the patient's subjective report of discomfort and disregard the laboratory values until a significant change occurs. Option B. Immediately notify the transplant physician of the sustained creatinine elevation and flank discomfort for further evaluation and potential intervention. Option C. Advise the patient to increase fluid intake, as dehydration can cause temporary creatinine increases. Option D. Document the findings and continue routine monitoring, as minor fluctuations are common in the early post-transplant period. The correct answer is D. Document the findings and continue routine monitoring, as minor fluctuations are common in the early post-transplant period. Explanation: scenario analysis. This scenario is professionally challenging because the nurse must interpret complex biomarker data in the context of a patient's clinical presentation to accurately assess the risk of acute cellular rejection. The challenge lies in distinguishing between subtle changes that may indicate early rejection versus those that could be attributed to other post-transplant complications or normal physiological responses. Timely and accurate assessment is critical for initiating appropriate immunosuppressive therapy and preventing graft loss. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates serial monitoring of specific biomarkers, such as serum creatinine, BUN, and potentially donor-derived cell-free DNA if available and indicated, with the patient's clinical signs and symptoms, e.g., fever, graft tenderness, decreased urine output. This holistic approach aligns with best professional practice by ensuring that diagnostic decisions are evidence-based and patient-centered. It adheres to the principles of vigilant post-transplant care, which mandate continuous monitoring and prompt intervention based on a multifactorial evaluation, as outlined in transplant nursing guidelines that emphasize the importance of correlating laboratory data with clinical findings. Incorrect approaches analysis. One incorrect approach is to solely rely on a single elevated biomarker reading without considering the patient's overall clinical status or trends. This fails to acknowledge the dynamic nature of post-transplant recovery and the potential for transient fluctuations in laboratory values. Ethically, this could lead to unnecessary interventions or delayed treatment, potentially harming the patient. Regulatory frameworks for transplant nursing emphasize a holistic patient assessment, not isolated data points. Another incorrect approach is to dismiss a concerning trend in biomarkers and clinical signs because the patient reports feeling fine. Patient-reported well-being is important, but it cannot override objective clinical and laboratory evidence of potential rejection. This approach risks underestimating the severity of the situation and delaying critical interventions, which is a failure to uphold the professional duty of care and adhere to established protocols for rejection monitoring. A third incorrect approach is to initiate a significant change in immunosuppression based on a single, unconfirmed biomarker elevation without consulting the transplant physician or nephrologist. Transplant protocols are highly individualized, and alterations to immunosuppression require expert medical oversight. Acting unilaterally based on incomplete data could lead to over-immunosuppression, increasing infection risk, or inappropriate adjustments that do not address the underlying issue, violating established collaborative care models and professional accountability. Professional reasoning. Professionals should employ a systematic approach to monitoring for rejection. This involves establishing baseline values for relevant biomarkers, understanding the expected post-transplant trajectory of these markers, and recognizing deviations from the norm. When deviations occur, the professional should 1. Correlate laboratory findings with the patient's current clinical presentation, including vital signs, physical assessment, and subjective complaints. 2. Review trends of biomarkers over time, not just isolated values. 3. Consult established transplant protocols and guidelines for specific biomarker thresholds and recommended actions. 4. Communicate any concerns or significant findings promptly to the transplant physician or nephrologist for further evaluation and management decisions. This structured approach ensures that patient care is evidence-based, collaborative, and aligned with regulatory and ethical standards for transplant nursing. Question 5. System analysis indicates that a post-transplant recipient is nearing discharge. The transplant nurse is responsible for a comprehensive risk assessment to ensure successful long-term graft survival and patient well-being. Which of the following approaches best addresses the multifaceted risks associated with this critical transition? Option A. Prioritizing the completion of discharge paperwork and scheduling the next clinic visit without a detailed discussion of the patient's psychosocial support system or their ability to manage complex post-transplant care independently. Option B. Conducting a thorough assessment of the patient's understanding of their medication regimen, potential side effects, and the importance of regular follow-up appointments, while also engaging the patient and their primary caregiver in a discussion about their readiness for self-management and identifying potential barriers to adherence. Option C. Relying solely on the physician's assessment of the patient's medical stability, assuming the patient and family are fully capable of managing post-transplant care. Option D. Focusing primarily on the patient's physical recovery and ensuring all surgical drains are removed and vital signs are stable, as this indicates readiness for discharge. Correct answer is B. Conducting a thorough assessment of the patient's understanding of their medication regimen, potential side effects, and the importance of regular follow-up appointments, while also engaging the patient and their primary caregiver in a discussion about their readiness for self-management and identifying potential barriers to adherence. Explanation. This scenario presents a professional challenge due to the inherent complexities of transplant nursing, which involve high-stakes patient care, intricate multidisciplinary collaboration, and significant ethical considerations. The nurse must balance the immediate needs of the patient with long-term outcomes, while navigating the expectations and concerns of various stakeholders, including the patient, their family, the transplant team, and the broader healthcare system. Careful judgment is required to ensure patient safety, optimize resource allocation, and uphold professional standards. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based risk assessment that directly involves the patient and their support system. This aligns with the ethical principles of autonomy and beneficence, ensuring that care decisions are informed by the patient's values and preferences, and that potential risks are proactively identified and mitigated. Regulatory frameworks for transplant nursing emphasize patient-centered care and shared decision-making, requiring nurses to actively engage patients in understanding and managing their health, especially in the context of a life-altering procedure like transplantation. This approach fosters trust and adherence to post-transplant protocols, which are critical for long-term graft survival and patient well-being. An incorrect approach that focuses solely on the immediate post-operative recovery, without considering the patient's long-term adherence to immunosuppression and lifestyle modifications, fails to meet regulatory requirements for comprehensive care planning. This oversight could lead to preventable complications such as graft rejection or infection, violating the principle of non-maleficence. Another incorrect approach that disregards the family's role in supporting the patient's recovery and adherence overlooks a crucial element of the patient's support network, potentially hindering successful outcomes and contravening guidelines that encourage family involvement in care. Finally, an approach that prioritizes the transplant team's immediate workload over a thorough assessment of the patient's psychosocial readiness for discharge and self-management neglects the holistic needs of the patient, potentially leading to readmission and compromising the integrity of the transplant program. Professional decision-making in similar situations requires a systematic process. First, identify the core problem and its potential impact on patient outcomes. Second, gather relevant information from all stakeholders, including the patient, family, and healthcare team. Third, evaluate the identified risks against established clinical guidelines and ethical principles. Fourth, develop a collaborative plan of care that addresses the identified risks and incorporates patient preferences. And fifth, continuously monitor and reassess the plan, making adjustments as needed. Question 6. System analysis indicates a potential for significant alloimmune response in a potential transplant recipient. Which of the following approaches best aligns with the regulatory framework for assessing and managing this risk? Option A. Evaluating the patient's history of prior transfusions, pregnancies, and previous transplantation to identify potential pre-existing sensitization. Option B. Prioritizing the immediate availability and dosage of standard immunosuppressive medications for post-transplant management. Option C. Assessing the surgical team's experience and the technical success rate of previous transplant surgeries performed by them. Option D. Focusing on the patient's current age and overall physical health status as primary indicators of immune reactivity. The correct answer is A. Evaluating the patient's history of prior transfusions, pregnancies, and previous transplantations to identify potential pre-existing sensitization. Explanation. This scenario is professionally challenging because it requires the transplant nurse to critically assess a patient's potential for alloimmune response, a complex biological process that can lead to graft rejection. The challenge lies in integrating knowledge of the mechanisms of alloimmunity with the practicalities of patient care and risk assessment, all within the strict regulatory framework governing transplant nursing. Careful judgment is required to identify the most significant risk factors and to implement appropriate monitoring and management strategies. The correct approach represents best professional practice because it directly addresses the core mechanisms of alloimmunity by focusing on the patient's sensitization history and the immunogenicity of the donor organ. This aligns with regulatory guidelines that mandate comprehensive pretransplant assessment and risk stratification to optimize patient outcomes and minimize complications. By prioritizing a thorough understanding of the patient's immunological profile and the donor-recipient match, the nurse is proactively identifying potential barriers to successful engraftment and can tailor post-transplant care accordingly. This approach is ethically sound as it prioritizes patient safety and well-being by anticipating and mitigating risks. An incorrect approach that focuses solely on the patient's age without considering their immunological history fails to address the fundamental drivers of alloimmunity. Age is a demographic factor, not a direct mechanism of alloimmune response. Regulatory frameworks emphasize evidence-based practice, and relying on age alone would be a deviation from established protocols for assessing transplant risk. Another incorrect approach that prioritizes the availability of immunosuppressive medications over the assessment of pre-existing sensitization overlooks a critical aspect of alloimmunity. While immunosuppression is vital, its effectiveness is significantly impacted by the degree of pre-existing immune memory. Ignoring sensitization history means the nurse is not adequately preparing for potential hyperacute or acute rejection, which can occur even with standard immunosuppressive regimens if the patient has a strong preformed antibody response. This represents a failure to adhere to best practices in transplant immunology and a potential breach of professional duty of care. A further incorrect approach that focuses on the surgical team's experience rather than the immunological compatibility between donor and recipient is also professionally unacceptable. While surgical expertise is important, it does not directly mitigate the immunological mechanisms of alloimmunity. The primary driver of graft rejection is the immune system's recognition of foreign antigens. Therefore, prioritizing surgical factors over immunological ones demonstrates a misunderstanding of the core challenges in transplantation and a failure to apply relevant knowledge. The professional decision-making process for similar situations should involve a systematic risk assessment that begins with understanding the patient's immunological history, including prior transplants, blood transfusions, and pregnancies, as these are key indicators of sensitization. This should be followed by a thorough evaluation of the donor-recipient immunological match, considering HLA typing and cross-match results. The nurse must then integrate this information with the patient's overall health status and the specific characteristics of the donor organ. This comprehensive approach, guided by regulatory requirements and ethical principles, allows for the development of a personalized care plan that anticipates and addresses the potential for alloimmune complications, thereby optimizing the chances of a successful transplant outcome. Question 7. Quality control measures reveal a significant discrepancy between the initial HLA typing report for a potential kidney transplant recipient and a subsequent confirmatory typing performed due to an unexpected antibody screen result. The initial report indicated a 4-antigen match, while the confirmatory typing shows only a 1-antigen match. The transplant surgery is scheduled for tomorrow. What is the most appropriate immediate action for the transplant nurse? Option A. Proceed with the transplant as scheduled, assuming the initial report was correct and the confirmatory typing may have an error, as delaying could jeopardize the patient's candidacy. Option B. Inform the transplant coordinator to update the patient's record with the new HLA typing, but allow the transplant to proceed based on the original plan. Option C. Immediately inform the transplant surgeon and the laboratory director of the discrepancy and recommend delaying the transplant until the HLA typing is definitively resolved. Option D. Contact the donor's transplant team to inquire about potential issues with the donor organ that might explain the discrepancy. The correct answer is C. Immediately inform the transplant surgeon and the laboratory director of the discrepancy and recommend delaying the transplant until the HLA typing is definitively resolved. Explanation. This scenario presents a professionally challenging situation because it requires the transplant nurse to interpret complex HLA typing, results in the context of patient safety and regulatory compliance. The challenge lies in balancing the urgency of transplant candidacy with the absolute necessity of accurate and reliable HLA matching to minimize the risk of graft rejection and ensure patient well-being. Misinterpretation or miscommunication of HLA data can have severe, life-threatening consequences for the recipient and significant ethical and legal ramifications for the healthcare team and institution. The correct approach represents best professional practice because it prioritizes patient safety and adheres to established protocols for managing critical laboratory findings. By immediately escalating the discrepancy to the transplant surgeon and laboratory director, the nurse ensures that the most qualified individuals are alerted to a potential issue that could impact transplant eligibility or post-transplant outcomes. This proactive communication aligns with regulatory guidelines that mandate clear, timely, and accurate reporting of patient information, especially when it pertains to life-saving procedures. It also reflects ethical obligations to advocate for the patient and ensure that all necessary steps are taken to optimize transplant success and minimize harm. An incorrect approach of proceeding with transplant without clarifying the HLA discrepancy would be a significant regulatory and ethical failure. It violates the principle of do no harm by potentially transplanting an organ that is poorly matched, leading to increased risk of rejection, organ failure, and the need for retransplantation. This would contravene guidelines from transplant accreditation bodies and potentially violate institutional policies regarding organ allocation and recipient selection. Another incorrect approach of solely relying on the initial report without further investigation ignores the possibility of laboratory error or the need for confirmatory testing, which is a critical component of quality assurance in transplant medicine. This failure to verify critical data undermines the integrity of the transplant process and exposes the patient to undue risk. Professionals should employ a decision-making framework that emphasizes a systematic approach to critical findings. This involves 1. Recognizing and validating the discrepancy, understanding the significance of the observed difference in HLA typing results. 2. Escalating to appropriate personnel, immediately informing the transplant surgeon and laboratory director, who have the authority and expertise to address such issues. 3. Following established protocols, adhering to institutional policies for managing laboratory discrepancies and transplant candidate evaluation. 4. Documenting all actions, maintaining a clear and accurate record of communications and decisions made. This framework ensures that patient care is guided by accurate information, regulatory compliance, and ethical principles. Question 8. The performance metrics show a significant increase in the number of patients experiencing acute hepatic decompensation while awaiting a liver transplant. A patient who has been on the waiting list for several months presents with rapidly worsening jaundice and ascites, but preliminary assessments indicate potential underlying cardiovascular compromise and borderline renal function that have not been fully investigated due to the urgency of their hepatic decline. The transplant coordinator is under pressure to expedite the patient's evaluation for transplant. What is the most appropriate course of action for the transplant nurse? Option A. Prioritize the patient's subjective desire for a transplant and advocate for expedited placement on the transplant list, focusing primarily on the severity of their liver disease. Option B. Proceed with the transplant evaluation and preparation, assuming that the risks associated with cardiovascular and renal compromise are manageable given the patient's critical liver failure. Option C. Initiate the process of transplant evaluation and preparation, but defer the detailed assessment of cardiovascular and renal function until after the transplant if the patient's condition remains critical. Option D. Advocate for the immediate completion of a comprehensive, multi-system transplant evaluation, including detailed assessment of cardiovascular and renal function, to ensure the patient meets all established medical criteria for transplant candidacy before proceeding. Correct answer is D. Advocate for the immediate completion of a comprehensive, multi-system transplant evaluation, including detailed assessment of cardiovascular and renal function, to ensure the patient meets all established medical criteria for transplant candidacy before proceeding. Explanation. This scenario is professionally challenging because it pits the immediate needs of a critically ill patient against the long-term, complex ethical and regulatory considerations of organ allocation and recipient suitability. The nurse must navigate the delicate balance of providing compassionate care while adhering strictly to established protocols designed to ensure fairness and maximize the utility of scarce donor organs. The core of the challenge lies in the potential for a patient's deteriorating condition to create pressure for expedited decisions that might bypass crucial, albeit time-consuming, evaluations. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of the patient's suitability for a liver transplant, aligning with the ethical principles of justice and beneficence, and adhering to the regulatory framework governing organ transplantation. This involves a thorough evaluation of all organ systems, particularly the cardiovascular and renal systems, as stipulated by transplant guidelines. These systems are critical for the successful integration and function of a transplanted liver and for the patient's overall survival post-transplant. Ignoring or downplaying potential issues in these areas would violate the principle of beneficence by exposing the patient to undue risk and the transplant program to suboptimal outcomes. Furthermore, it upholds the principle of justice by ensuring that the patient meets established criteria, preventing an unfair advantage or disadvantage in the allocation process. Adherence to these established protocols is mandated by regulatory bodies that oversee organ transplantation to ensure equitable distribution and maximize patient survival. An incorrect approach that focuses solely on the patient's immediate hepatic decompensation without a full systemic workup is professionally unacceptable. This failure would represent a breach of the principle of non-maleficence by potentially proceeding with a transplant in a patient who is not medically stable enough to withstand the procedure and its aftermath, leading to increased morbidity or mortality. It also violates the principle of justice by potentially allocating a life-saving organ to someone who may not have the physiological capacity to benefit from it, thereby diverting it from a potentially more suitable candidate. Such an approach would also contravene specific regulatory guidelines that mandate comprehensive pre-transplant evaluations to ensure recipient safety and transplant success. Another incorrect approach that prioritizes the patient's subjective desire for transplant over objective medical criteria is also professionally unacceptable. This disregards the ethical principle of beneficence, as it fails to act in the patient's best medical interest, and potentially violates non-maleficence by exposing them to significant surgical and post-operative risks without adequate physiological preparation. It also undermines the regulatory framework, which is built on objective medical criteria to ensure fair and equitable allocation. A third incorrect approach that involves circumventing established protocols due to perceived urgency, without explicit authorization or a documented, justifiable deviation based on emergent, life-threatening findings that have been thoroughly assessed and communicated, is a serious ethical and regulatory failure. This breaches the principles of justice and accountability, as it bypasses the structured, transparent system designed for organ allocation. It also risks compromising patient safety and the integrity of the transplant program, violating regulatory mandates for standardized procedures. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understand the patient's current clinical status and the immediate concerns. Second, consult and strictly adhere to the established institutional and national transplant guidelines regarding recipient selection and evaluation, paying close attention to the requirements for all relevant organ systems. Third, collaborate closely with the multidisciplinary transplant team, including surgeons, physicians, social workers, and ethicists, to discuss findings and potential challenges. Fourth, ensure all necessary diagnostic evaluations are completed and reviewed before any decision is made regarding transplant candidacy. Finally, document all assessments, consultations, and decisions meticulously, ensuring transparency and accountability throughout the process. Question 9. Stakeholder feedback indicates a need to refine the process for evaluating potential organ recipients. Considering the critical importance of immunological compatibility in transplant success, which of the following approaches best ensures optimal patient outcomes and minimizes the risk of graft rejection? Option A. Prioritize organ acceptance based solely on the urgency of the recipient's medical condition, with immunological factors being a secondary consideration. Option B. rely exclusively on the transplant surgeon's experience to gauge immunological compatibility, bypassing a formal review of laboratory immunological data. Option C. Conduct a comprehensive immunological assessment, including detailed HLA matching, donor-specific antibody screening, and cross-match analysis, before confirming organ acceptance and proceeding with transplantation. Option D. Proceed with transplantation immediately upon identification of a suitable donor organ, deferring a detailed immunological assessment until post-transplant. The correct answer is D. Proceed with transplantation immediately upon identification of a suitable donor organ, deferring a detailed immunological assessment until post-transplant. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the transplant nurse to balance the immediate need for a viable organ with the long-term immunological risks to the recipient. The decision-making process is complex, involving interpretation of immunological data, understanding of donor-recipient compatibility, and adherence to established protocols for managing immunosuppression. Failure to accurately assess immunological considerations can lead to graft rejection, increased morbidity, and potentially mortality for the recipient, impacting patient outcomes and resource utilization. Correct approach analysis. The correct approach prioritizes a comprehensive immunological assessment before proceeding with transplantation. This aligns with best professional practice by ensuring that all available data regarding donor-specific antibodies, HLA matching, and cross-match results are thoroughly reviewed and interpreted. This proactive approach minimizes the risk of hyperacute or acute antibody-mediated rejection, which can be devastating. Ethically, it upholds the principle of beneficence by acting in the best interest of the patient's long-term health and well-being. Regulatory frameworks for transplantation emphasize patient safety and optimal outcomes, which are directly supported by rigorous pre-transplant immunological evaluation. Incorrect approaches analysis. One incorrect approach involves proceeding with transplantation based solely on the availability of a donor organ without a complete immunological workup. This represents a significant regulatory and ethical failure. It violates the principle of non-maleficence by exposing the patient to an unacceptable risk of immediate graft loss due to preformed antibodies. It also disregards established clinical guidelines and potentially regulatory requirements for organ acceptance and transplantation, which mandate thorough immunological assessment. Another incorrect approach is to delay transplantation indefinitely due to minor immunological incompatibilities, without exploring potential mitigation strategies. Caution is warranted. An overly conservative stance can lead to the loss of a viable organ and prolonged waiting times for the recipient, potentially worsening their overall health status. This can be seen as a failure to act in the patient's best interest, beneficence, and a suboptimal use of scarce resources. It may also contravene guidelines that encourage the use of desensitization protocols or other advanced immunological management strategies when appropriate. A third incorrect approach is to rely solely on the transplant surgeon's clinical judgment without a detailed review of the immunological data by the transplant nurse and immunologist. While surgeon expertise is crucial, the nurse plays a vital role in synthesizing complex immunological information and ensuring all aspects of patient safety are addressed. This approach creates a siloed decision-making process, increasing the risk of overlooking critical immunological factors that could impact graft survival. It fails to adhere to multidisciplinary team requirements often mandated by regulatory bodies and professional standards for complex medical decisions. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a thorough understanding of the patient's immunological profile and the donor organ's characteristics. This involves actively seeking and critically evaluating all available immunological data, including HLA typing, donor-specific antibody screening, and cross-match results. Collaboration with the transplant immunology laboratory and the multidisciplinary transplant team is essential. When potential immunological challenges are identified, professionals should consult established protocols and guidelines for managing these risks, which may include desensitization therapies or alternative donor options. The ultimate decision should be based on a comprehensive risk-benefit analysis that prioritizes patient safety and long-term graft survival, in accordance with regulatory requirements and ethical principles. Question 10. Benchmark analysis indicates that following a successful kidney transplant, A nurse is assessing the patient. The nurse notes a sudden decrease in urine output from the newly transplanted kidney and a slight increase in the recipient's blood pressure. Which of the following approaches best reflects best practice in this immediate post-operative period, considering the anatomy and physiology of renal transplantation? Option A. Wait for the recipient to report any discomfort or changes in sensation related to the transplanted kidney before taking further action. Option B. Immediately initiate a focused assessment of the transplanted kidney's perfusion and function, including Doppler assessment of renal artery flow and assessment of bladder pressures, and notify the transplant surgeon of the findings. Option C. Focus primarily on managing the recipient's pain and anxiety, as these are common postoperative issues that can affect physiological parameters. Option D. Continue routine postoperative monitoring, assuming the decrease in urine output is a temporary side effect of anesthesia, and the blood pressure increase is a common postoperative response. The correct answer is B. Immediately initiate a focused assessment of the transplanted kidney's perfusion and function, including Doppler assessment of renal artery flow and assessment of bladder pressures, and notify the transplant surgeon of the findings. Explanation: this scenario presents a professional challenge due to the critical nature of organ transplantation and the immediate physiological consequences of organ ischemia. Transplant nurses must possess a profound understanding of the anatomy and physiology of the donor organ and the recipient's cardiovascular and immune systems to anticipate and manage potential complications. The ability to quickly assess and interpret physiological data is paramount for timely intervention, directly impacting patient outcomes and adherence to post-transplant protocols. The correct approach represents best professional practice because it prioritizes immediate, evidence-based assessment of the transplanted organ's physiological status. This aligns with the core principles of patient care and transplantation, emphasizing prompt recognition of compromised perfusion or function. Regulatory frameworks governing transplant nursing, such as those established by the Organ Procurement and Transplantation Network, (OPTN), in the U.S., mandate vigilant monitoring and rapid response to adverse events to ensure patient safety and optimize graft survival. Ethically, this approach upholds the principle of beneficence by acting in the patient's best interest to prevent irreversible damage. An incorrect approach that focuses solely on the recipient's pre-existing conditions without considering the immediate post-transplant organ status fails to acknowledge the unique vulnerabilities of the newly transplanted organ. This neglects the critical window of a perfusion injury and the immediate physiological demands placed on the graft. Regulatory failure lies in not adhering to established post-transplant monitoring protocols designed to detect early signs of organ dysfunction. Ethically, this represents a failure of non-maleficence by potentially delaying necessary interventions. Another incorrect approach that delays assessment until the patient reports subjective symptoms is also professionally unacceptable. Transplanted organs, especially those with compromised perfusion, may not immediately elicit overt patient-reported symptoms. Relying solely on subjective reporting can lead to significant delays in diagnosis and treatment, increasing the risk of graft loss. This violates regulatory requirements for proactive, objective assessment and the ethical duty to provide timely care. A further incorrect approach that prioritizes routine laboratory draws over direct physiological assessment of the graft's perfusion is also flawed. While laboratory values are important, they are often lagging indicators of acute physiological compromise. Direct assessment of organ perfusion, such as through Doppler ultrasound or assessment of urine output in kidney transplants, provides more immediate and actionable data. Regulatory adherence requires a comprehensive assessment strategy that includes both objective and subjective data, with a focus on immediate physiological indicators. Ethically, this approach prioritizes less critical data over potentially life-saving interventions. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize the immediate post-transplant period as a high-risk phase requiring heightened vigilance. 2. Prioritize assessment of the transplanted organ's perfusion and function using a combination of objective measures, e.g., vital signs, urine output, Doppler assessment, and subjective patient reports. 3. Correlate findings with expected physiological responses and potential complications. 4. Initiate timely interventions based on evidence-based protocols and consult with the multidisciplinary transplant team. 5. continuously reassess the patient's response to interventions. This process ensures adherence to regulatory standards and ethical obligations for optimal patient care. Question 11. The assessment process reveals a post-transplant patient expresses significant anxiety about the lifelong commitment to immunosuppressive medications, questioning their necessity and expressing concerns about potential long-term side effects impacting their quality of life. As the certified transplant nurse, which approach best addresses this patient's concerns while ensuring optimal graft survival? Option A. Acknowledge the patient's anxieties, validate their concerns, and collaboratively develop a personalized education plan that addresses their specific questions about the medications, their mechanisms of action, the consequences of non-adherence, and strategies for managing potential side effects. Option B. Schedule a follow-up appointment with the transplant nephrologist to discuss the patient's concerns and explore potential alternative immunosuppressive agents or dosing adjustments that might mitigate side effects while maintaining efficacy. Option C. Advise the patient that these concerns are common and that they will likely adapt over time, encouraging them to focus on the positive outcomes of the transplant and to avoid dwelling on potential negative aspects of the medication. Option D. Reiterate the critical importance of immunosuppression for preventing organ rejection and provide a standard pamphlet on common side effects, emphasizing that adherence is non-negotiable. The correct answer is D. Reiterate the critical importance of immunosuppression for preventing organ rejection and provide a standard pamphlet on common side effects, emphasizing that adherence is non-negotiable. Explanation. The assessment process reveals a common challenge in transplant nursing, managing patient adherence to complex immunosuppressive regimens. This scenario is professionally challenging because it requires the nurse to balance the critical need for lifelong immunosuppression to prevent organ rejection with the patient's individual circumstances, potential side effects, and understanding of the therapy. The nurse must act as an educator, advocate, and assessor, ensuring the patient can safely and effectively manage their medication. The correct approach represents best professional practice because it prioritizes patient education and empowerment. By actively involving the patient in understanding their medication, its purpose, potential side effects, and the consequences of non-adherence, the nurse fosters a collaborative relationship. This aligns with ethical principles of autonomy and beneficence, ensuring the patient can make informed decisions about their health. Furthermore, it directly addresses the core of transplant care, which is to maintain graft survival through consistent immunosuppression, thereby preventing graft loss and its associated morbidity and mortality. This approach also implicitly adheres to regulatory guidelines that mandate patient education and informed consent for medical treatments. An incorrect approach that focuses solely on prescribing the medication without assessing the patient's understanding or barriers to adherence is a significant regulatory and ethical failure. It violates the principle of patient autonomy by not ensuring informed consent and can lead to non-adherence, directly contravening the goal of preventing graft rejection, which is a primary clinical objective and implicitly regulated by standards of care. Another incorrect approach that dismisses the patient's concerns about side effects without proper investigation or management is also ethically problematic. It fails to uphold the principle of non-maleficence by potentially allowing the patient to suffer unnecessarily from adverse drug reactions, and it neglects the nurse's responsibility to monitor and manage treatment complications. A third incorrect approach that assumes the patient will automatically adhere without any reinforcement or follow-up neglects the complex psychosocial factors that influence medication adherence in chronic disease management, leading to potential clinical deterioration and contravening best practice standards for chronic care management. The professional decision-making process for similar situations should involve a systematic assessment of the patient's knowledge, beliefs, and barriers related to their immunosuppressive therapy. This includes open-ended questioning, active listening, and a non-judgmental attitude. The nurse should then tailor educational interventions to the patient's specific needs and learning style, reinforcing key messages about the importance of adherence and symptom management. Ongoing monitoring and regular follow-up are crucial to identify and address any emerging issues, ensuring the patient remains engaged and supported in their treatment plan. This iterative process of assessment, education, and support is fundamental to optimizing outcomes in transplant recipients. Question 12. Benchmark analysis indicates that in the selection of potential recipients for a life-saving organ transplant, a critical aspect of the pre-transplant evaluation involves a comprehensive risk assessment. Which of the following approaches best aligns with established regulatory frameworks and ethical best practices for this assessment? Option A. Relying on the collective experience of the transplant team to identify suitable candidates, without the need for a formal, documented risk assessment protocol. Option B. Prioritizing patients who express the strongest desire for a transplant, as this often correlates with better postoperative motivation and outcomes. Option C. A systematic evaluation of the patient's overall health status, including comorbidities, psychosocial support systems, and potential for adherence to post-transplant care, alongside an assessment of the organ's suitability for the individual. Option D. Focusing primarily on the immediate medical urgency of the patient's condition, as the scarcity of organs necessitates swift decision-making. The correct answer is C. A systematic evaluation of the patient's overall health status, including comorbidities, psychosocial support systems, and potential for adherence to post-transplant care, alongside an assessment of the organ's suitability for the individual. Explanation: this scenario is professionally challenging because it requires the transplant nurse to balance the urgency of organ transplantation with the ethical and regulatory imperative to ensure patient safety and suitability. The selection process is not merely a medical decision, but is governed by strict protocols designed to optimize outcomes for both the recipient and the donor organ, while adhering to legal and ethical standards. Careful judgment is required to identify potential risks that could compromise the transplant's success or the patient's well-being post-transplant. The correct approach represents best professional practice because it systematically evaluates a broad spectrum of patient factors that could impact transplant viability and post-operative recovery. This aligns with the core principles of patient-centered care and the regulatory framework governing organ transplantation, which mandates comprehensive risk assessment to ensure that transplantation is performed only when the potential benefits clearly outweigh the risks. This thorough evaluation minimizes the likelihood of adverse events, improves graft survival rates, and upholds the ethical obligation to provide the best possible care within established guidelines. An approach that focuses solely on the immediate medical need for a transplant without a comprehensive risk assessment fails to meet regulatory requirements. Such a narrow focus could lead to the selection of a patient who is not medically optimized for the procedure, increasing the risk of complications, graft failure, and potentially compromising the limited supply of donor organs. This oversight constitutes a failure to adhere to established patient selection criteria and best practice guidelines, which are often codified in regulatory frameworks designed to ensure equitable and effective organ allocation. An approach that prioritizes patient desire over objective medical and psychosocial evaluation is ethically unsound and violates regulatory mandates. While patient autonomy is crucial, it must be exercised within the bounds of medical safety and feasibility. Ignoring significant contraindications or unaddressed psychosocial issues that could impede post-transplant adherence to complex medical regimens is a dereliction of professional duty and a breach of regulatory oversight. An approach that relies on anecdotal evidence or past experiences with similar patients, without a systematic, evidence-based risk assessment, is unprofessional and potentially harmful. Transplant medicine is a rapidly evolving field, and current best practices and regulatory guidelines are based on extensive research and data. Deviating from these established protocols without a clear, documented rationale based on current evidence introduces an unacceptable level of risk and may not comply with the required standards of care. The professional decision-making process for similar situations should involve a structured, multidisciplinary approach. This includes a thorough review of the patient's medical history, current health status, psychosocial factors, and adherence potential. It requires consultation with the entire transplant team, including surgeons, physicians, social workers, and ethicists, to ensure all aspects of the patient's suitability are considered. Adherence to institutional policies and national/regional organ allocation guidelines is paramount. Documentation of the assessment process and the rationale for selection or non-selection is critical for accountability and continuous quality improvement. Question 13. Assessment of the appropriate next steps for a certified transplant nurse when a patient is declared brain dead and the family expresses a desire to donate the patient's organs, but there is no documented evidence of the patient's prior consent or refusal. The nurse must consider the legal framework governing organ donation in their specific jurisdiction. Option A. Consult the hospital's legal counsel to determine the legal requirements for obtaining consent for organ donation in the absence of documented patient wishes. Option B. Inform the family that organ donation is not possible without prior written consent from the deceased. Option C. Proceed with organ procurement only after confirming the deceased's explicit consent through a donor registry or documented advance directive, or if legally permissible, obtaining consent from the next of kin according to established protocols. Option D. Initiate the organ procurement process immediately, as the family's desire to donate signifies consent. The correct answer is D. Initiate the organ procurement process immediately, as the family's desire to donate signifies consent. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a complex interplay of patient autonomy, family wishes, and legal mandates surrounding organ donation. The nurse must navigate potential conflicts between the deceased's known wishes, or lack thereof, and the family's immediate emotional distress and differing perspectives. Balancing respect for the deceased's potential autonomy with the family's grief and legal obligations requires careful communication, ethical sensitivity, and a thorough understanding of organ donation laws. Correct approach analysis. The correct approach prioritizes adherence to established legal frameworks and ethical guidelines for organ donation. This involves verifying the deceased's consent status according to the relevant jurisdiction's laws, e.g., presumed consent, explicit consent, or first-person consent registry. If the deceased's wishes are documented or clearly known, these must be respected. If not, the legally designated next of kin must be approached for consent, following established protocols that ensure they are fully informed and not unduly pressured. This approach upholds patient rights, legal requirements, and the integrity of the organ donation process, ensuring that donation proceeds only with valid authorization. Incorrect approaches analysis. Approaching the family for consent without first confirming the deceased's documented wishes or legal consent status is a failure to adhere to the established legal framework for organ donation. This bypasses crucial steps designed to protect the deceased's autonomy and can lead to donation against their known wishes or without proper legal authorization. Proceeding with organ procurement based solely on the family's expressed desire, without verifying the deceased's consent status according to the jurisdiction's laws, is a significant legal and ethical failure. It disregards the primary legal authority for donation, which rests with the deceased's consent, either explicit or presumed by law. Delaying the discussion about organ donation until after the family has been informed of the patient's death and has had time to grieve, without any attempt to ascertain the deceased's prior wishes or legal consent status, may miss critical windows for donation, and could be interpreted as a failure to explore all legally permissible avenues for donation in a timely manner, depending on the specific jurisdictional laws regarding the timing of such discussions. Professional reasoning. Professionals should employ a structured decision-making process that begins with understanding the legal framework of organ donation in their jurisdiction. This includes identifying the hierarchy of consent, e.g., donor registry, written consent, family consent. The next step involves gathering information about the patient's wishes, including checking for donor registration or any documented advance directives. If the patient's wishes are unclear or undocumented, the nurse must then engage with the family, providing clear, unbiased information about the organ donation process and their legal role in providing consent, strictly following established protocols. Throughout this process, maintaining patient confidentiality and respecting the family's emotional state are paramount. Question 14. Comparative studies suggest that while medical urgency is a primary driver for transplant consideration, the long-term success of a transplant is significantly influenced by factors beyond immediate physiological need. Considering the regulatory framework for transplant candidate selection, which of the following approaches best reflects the implementation of these criteria in practice? Option A. Prioritizing candidates based on a comprehensive, multidisciplinary evaluation that includes objective medical criteria, a thorough psychosocial assessment of readiness and adherence potential, and a clear understanding of the post-transplant care regimen. Option B. Expediting the evaluation process for candidates who present with the most severe immediate symptoms, assuming their commitment to post-transplant care will be addressed later. Option C. Selecting candidates primarily based on the strength of their personal relationships and the perceived willingness of their social network to provide support, irrespective of individual psychosocial readiness. Option D. Allowing individual transplant coordinators to make final candidate selection decisions based on their clinical intuition and experience, without strict adherence to established protocols. The correct answer is A. Prioritizing candidates based on a comprehensive, multidisciplinary evaluation that includes objective medical criteria, a thorough psychosocial assessment of readiness and adherence potential, and a clear understanding of the post-transplant care regimen. Explanation. This scenario presents a common implementation challenge in transplant nursing, balancing the desire to offer life-saving interventions with the strict, evidence-based criteria for candidate selection. The professional challenge lies in navigating the complex interplay of medical urgency, psychosocial readiness, and resource allocation, all while adhering to the established regulatory framework for transplant candidate selection. Careful judgment is required to ensure fairness, equity, and optimal patient outcomes. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary evaluation that aligns with the established regulatory framework for transplant candidate selection. This framework, often guided by organizations like the Organ Procurement and Transplantation Network, (OPTAN) in the U.S., emphasizes objective medical criteria, a thorough psychosocial assessment, and a clear demonstration of patient understanding and commitment to the rigorous post-transplant regimen. Adherence to these guidelines ensures that candidates are selected based on their likelihood of benefiting from the transplant and their capacity to manage the complex care required, thereby maximizing the utility of scarce donor organs and promoting long-term graft survival. This approach upholds ethical principles of justice and beneficence by ensuring fair access and promoting the best interests of the patient and the transplant program. An incorrect approach that focuses solely on medical urgency without a robust psychosocial assessment fails to meet regulatory requirements. The regulatory framework mandates a holistic evaluation, recognizing that a patient's ability to adhere to post-transplant medication, follow-up appointments, and lifestyle modifications is as critical as their immediate medical need. Neglecting this aspect can lead to poor graft outcomes, patient harm, and inefficient use of resources. Another incorrect approach that prioritizes a candidate based on their social support network alone, without a thorough medical and psychosocial evaluation, also violates regulatory and ethical standards. While social support is a crucial component of post-transplant care, it cannot supersede objective medical criteria or the candidate's individual capacity to manage their health. This approach risks overlooking critical medical contraindications or psychosocial barriers that could jeopardize the transplant's success. Furthermore, an approach that allows for subjective bias or personal preference in candidate selection, deviating from established, objective criteria, represents a significant regulatory and ethical failure. Transplant candidate selection is designed to be as objective and standardized as possible to ensure fairness and prevent discrimination. Personal biases can lead to inequitable access to life-saving treatment and undermine the integrity of the transplant program. The professional decision-making process for similar situations should involve a systematic, evidence-based approach. This includes 1. Thoroughly understanding and applying the specific regulatory guidelines and institutional policies governing transplant candidate selection. 2. Engaging in a comprehensive, multidisciplinary team assessment that includes physicians, surgeons, transplant coordinators, social workers, psychologists, and financial counselors. 3. Documenting all assessments and decisions meticulously, ensuring transparency and accountability. 4. Prioritizing patient education and shared decision-making throughout the evaluation process. 5. Regularly reviewing and updating knowledge of evolving best practices and regulatory changes in transplant medicine. Question 15. Governance review demonstrates a recent transplant recipient is experiencing a sudden onset of graft tenderness, fever, and a significant decrease in urine output within the first 24 hours post-transoperatively. Laboratory results show a marked increase in serum creatinine and a positive crossmatch from pre-transplant screening that was initially considered borderline. The transplant team is considering various causes for these findings. Which of the following represents the most immediate and critical concern requiring urgent intervention? Option A, the development of chronic rejection manifesting early post-transplant. Option B, the possibility of hyperacute rejection due to preformed antibodies. Option C, the potential for acute cellular rejection requiring immunosuppression adjustment. Option D, a postoperative infection unrelated to the transplant itself. The correct answer is B, the possibility of hyperacute rejection due to preformed antibodies. Explanation: this scenario presents a common yet critical challenge in transplant nursing, accurately identifying and responding to different types of organ rejection. The professional challenge lies in the immediate and distinct management required for each rejection type, where delayed or incorrect intervention can have severe consequences for graft survival and patient outcomes. Careful judgment is required to differentiate between the timing, clinical presentation, and underlying mechanisms of hyperacute, acute, and chronic rejection, as well as to understand the specific diagnostic and therapeutic pathways mandated by transplant protocols and regulatory guidelines. Correct approach represents best professional practice because it aligns with the established diagnostic and management pathways for organ rejection as outlined by transplant centers and supported by regulatory frameworks governing transplant care. This approach prioritizes rapid assessment and intervention based on the most likely cause of the observed clinical signs and laboratory findings, ensuring that the patient receives timely and appropriate treatment. For example, recognizing signs suggestive of hyperacute rejection necessitates immediate surgical intervention, while acute rejection requires prompt immunosuppression adjustment. Chronic rejection, though often irreversible, still requires careful monitoring and management to slow progression. Adherence to these protocols ensures patient safety, optimizes graft function, and meets the standards of care expected within the transplant nursing profession. An incorrect approach that delays definitive diagnosis or initiates inappropriate treatment would represent a significant regulatory and ethical failure. For instance, misinterpreting signs of acute cellular rejection as a mere infection and delaying immunosuppression adjustment would violate the standard of care and potentially lead to irreversible graft damage, contravening ethical obligations to provide competent care and regulatory requirements for timely intervention. Similarly, failing to recognize the potential for hyperacute rejection and proceeding with standard postoperative care without immediate surgical consultation would be a critical error, potentially leading to graft loss and violating patient safety protocols. Initiating treatment for chronic rejection in the presence of acute rejection symptoms would also be a failure to apply appropriate diagnostic reasoning and could compromise the graft. Professional decision-making in such situations should follow a systematic process. 1. Thoroughly assess the patient's clinical presentation, vital signs, and any new symptoms. 2. Review recent laboratory results, including serology, organ function tests, and any specific transplant-related markers. 3. Correlate findings with the patient's post-transplant timeline and known risk factors for different rejection types. 4. Consult transplant physician and multidisciplinary team promptly, presenting a clear differential diagnosis of potential rejection types. 5. Initiate diagnostic investigations as per established transplant center protocols for suspected rejection. 6. Implement immediate interventions based on the most likely diagnosis and physician orders, prioritizing patient safety and graft preservation. Question 16. To address the challenge of accurately defining the scope of transplantation for patient care and regulatory compliance, which of the following best encapsulates the fundamental definition and overview of transplantation as understood within the certified transplant nurse's professional purview? Option A. The process of replacing a diseased or damaged organ or tissue with a healthy one, which may originate from a living or deceased donor, and includes various types of grafts. Option B. The transplantation of solid organs only, excluding hematopoietic stem cell transplants or tissue grafts. Option C. The medical intervention solely focused on the surgical procedure of organ replacement, excluding pre- and post-operative care. Option D. The surgical removal of a diseased organ and its immediate replacement with a healthy organ from a deceased donor. The correct answer is D. The surgical removal of a diseased organ and its immediate replacement with a healthy organ from a deceased donor. Explanation: the scenario presents a challenge in defining and understanding transplantation within the context of the certified transplant nurse exam's regulatory framework. This requires a precise understanding of what constitutes a transplant procedure according to established guidelines, ensuring accurate patient education, documentation, and adherence to legal and ethical standards. Misinterpreting the scope of transplantation can lead to significant clinical and administrative errors. The correct approach accurately reflects the broad definition of transplantation as the replacement of a diseased or damaged organ or tissue with a healthy one, encompassing both living and deceased donor sources, and including various types of grafts: autograft, allograft, xenograft. Though xenografts are less common in human transplantation, this aligns with the foundational knowledge expected of a certified transplant nurse, ensuring they can correctly identify and manage patients involved in any form of organ or tissue replacement, adhering to all relevant regulations regarding consent, donor management, recipient care, and post-transplant follow-up. An incorrect approach might narrowly define transplantation to only include solid organ transplants from deceased donors, thereby excluding crucial aspects like living donor kidney or liver transplants, or bone marrow/stem cell transplants. This failure to encompass the full spectrum of transplant procedures would violate the comprehensive understanding required by the regulatory framework, potentially leading to misclassification of patient cases, incorrect application of protocols, and inadequate patient counseling regarding their specific transplant type. Another incorrect approach might focus solely on the surgical act, neglecting the critical pre- and post-operative phases, which are integral to the definition and management of transplantation under nursing standards. This oversight would fail to recognize the holistic nature of transplant care mandated by professional guidelines. Professional decision-making in such situations requires a systematic approach. First, identifying the core concept being tested definition of transplantation. Second, recalling the established definitions and scope as per the certified transplant nurse exam's specific regulatory and professional guidelines. Third, evaluating each option against this established definition, looking for the most comprehensive and accurate representation. And finally, selecting the option that best aligns with the breadth and depth of knowledge expected for certified practice. Question 17. Market research demonstrates that timely and accurate assessment of organ viability and recipient readiness is critical in transplant procedures. A transplant coordinator receives notification of a potential donor organ offer for a critically ill patient awaiting a liver transplant. The organ procurement organization provides initial information, but there is a slight delay in receiving the full donor profile and organ quality assessment. The patient is currently stable but requires immediate preparation for potential surgery. Which of the following approaches best aligns with best professional practice and regulatory compliance in this scenario? Option A. Proceed with the transplant surgery without waiting for the full donor profile, assuming the organ is viable based on initial information. Option B. Inform the patient's family that the organ offer is uncertain and postpone any preparation until definitive information is available, even if it means a significant delay. Option C. Delay all patient preparation until the complete donor profile and organ quality assessment are received and reviewed to avoid unnecessary patient mobilization. Option D. Initiate patient preparation for surgery immediately while simultaneously expediting communication with the organ procurement organization to obtain the complete donor profile and organ quality assessment. The correct answer is D. Initiate patient preparation for surgery immediately while simultaneously expediting communication with the organ procurement organization to obtain the complete donor profile and organ quality assessment. Explanation: this scenario is professionally challenging because it requires the transplant nurse to balance immediate patient needs with complex, evolving post-transplant protocols and potential donor organ viability. The nurse must exercise critical judgment in assessing the patient's condition, understanding the implications of delays, and communicating effectively with the surgical team and organ procurement organization, all while adhering to strict regulatory timelines and ethical considerations. The correct approach represents best professional practice because it prioritizes patient safety and optimal organ utilization within the established regulatory framework. This involves a proactive and collaborative approach, ensuring all necessary assessments are completed promptly and that communication channels remain open. Adherence to established protocols for organ acceptance and patient preparation, as guided by transplant center policies and relevant professional standards e.g. UNOS/opt-in policies in the U.S., is paramount. This ensures that decisions are evidence-based, ethically sound, and legally compliant, minimizing risks to both the recipient and the donor organ. An incorrect approach that involves delaying the patient's preparation due to uncertainty about organ viability without consulting the surgical team or organ procurement organization represents a significant regulatory and ethical failure. This delay could lead to the loss of a viable organ, violating the ethical principle of beneficence towards the potential recipient and the broader societal goal of maximizing organ availability. It also fails to adhere to the time-sensitive nature of organ transplantation, potentially contravening UNO/opt-in guidelines regarding organ acceptance and allocation timelines. Another incorrect approach, such as proceeding with preparation without confirming all necessary pre-transplant clearances and consents, poses serious ethical and regulatory risks. This could lead to a compromised transplant, patient harm, or legal repercussions for the institution. It demonstrates a failure to uphold the principles of informed consent and patient autonomy, as well as a disregard for institutional policies and regulatory requirements designed to ensure patient safety and the integrity of the transplant process. A further incorrect approach, such as unilaterally deciding to decline the organ without a comprehensive team discussion and adherence to established protocols, is also professionally unacceptable. This bypasses the collaborative decision-making process essential in transplantation and may not align with institutional policies or national allocation guidelines. It can lead to suboptimal resource allocation and potentially deny a suitable recipient the opportunity for a life-saving transplant. The professional decision-making process for similar situations should involve a systematic approach. 1. Immediate assessment of the patient's current clinical status and readiness for transplant. 2. Prompt and clear communication with the surgical team and the organ procurement organization to gather all essential information regarding the donor organ and any potential concerns. 3. Review of established transplant center protocols and relevant regulatory guidelines, e.g., UNO/opt-in policies, pertaining to organ acceptance, patient preparation, and timeframes. 4. Collaborative decision-making with the multidisciplinary transplant team, weighing all available data and potential risks and benefits. 5. Ensuring all necessary consents and clearances are obtained and documented before proceeding with any transplant-related interventions. 6. Maintaining meticulous documentation of all assessments, communications, and decisions throughout the process. Question 18. Stakeholder feedback indicates a recurring concern among potential recipients and their families regarding the perceived interchangeability of different transplant types. A nurse is caring for a patient being evaluated for a potential transplant. The family expresses confusion, stating, "We understand it's a transplant, but what's the real difference between getting a new organ, some tissue, or stem cells? Will the recovery be the same?" Which approach best addresses this professional challenge and ensures adherence to regulatory and ethical standards for transplant nursing? Option A. Briefly explain that organ transplants involve replacing a whole organ, tissue transplants involve replacing specific tissues, and stem cell transplants involve blood-forming cells, without delving into the specific implications for this patient's evaluation. Option B. Provide a detailed explanation of the specific risks, benefits, recovery timelines, and long-term management unique to the patient's potential organ transplant, while also clarifying the fundamental distinctions between organ, tissue, and stem cell transplantation, and assessing the family's comprehension at each step. Option C. Reassure the family that all transplant procedures are complex and require significant recovery, and that the medical team will manage all aspects of the process, implying that the specific type of transplant is a minor detail. Option D. Emphasize that the physician will provide all necessary details about the transplant type during the upcoming consultation, and the nurse's role is primarily supportive care during the evaluation phase. The correct answer is B. Provide a detailed explanation of the specific risks, benefits, recovery timelines, and long-term management unique to the patient's potential organ transplant, while also clarifying the fundamental distinctions between organ, tissue, and stem cell transplantation, and assessing the family's comprehension at each step. Explanation. This scenario is professionally challenging because it requires the transplant nurse to navigate complex patient and family expectations regarding different types of transplantation, while adhering to strict regulatory frameworks and ethical guidelines. The nurse must ensure that all parties understand the distinct risks, benefits, and processes associated with organ, tissue, and stem cell transplantation, as these are not interchangeable procedures. The correct approach represents best professional practice because it prioritizes comprehensive, individualized patient and family education. This aligns with the ethical principle of autonomy, ensuring informed consent by providing accurate and understandable information about the specific type of transplantation being considered. Regulatory frameworks for transplant nursing, such as those governed by the Organ Procurement and Transplantation Network, (OPTN), in the U.S., emphasize patient education and the importance of understanding the nuances of each transplant modality. This approach also supports the professional responsibility to advocate for the patient's best interests by clarifying potential misunderstandings that could lead to suboptimal outcomes or dissatisfaction. An incorrect approach that focuses solely on the general concept of transplantation without differentiating between organ, tissue, and stem cell transplantation fails to meet the regulatory requirement for specific informed consent. This can lead to a violation of patient autonomy and potentially breaches ethical obligations to provide clear and accurate information. Another incorrect approach that assumes all transplant types have similar recovery protocols or success rates is also professionally unacceptable. It ignores the distinct biological and medical complexities of each type, potentially leading to unrealistic expectations and inadequate preparation for post-transplant care, which could violate professional standards of care and patient safety guidelines. A third incorrect approach that defers all detailed explanation to the physician without engaging in active nursing assessment of understanding overlooks the nurse's crucial role in reinforcing information, assessing comprehension, and addressing patient-specific concerns, thereby failing to uphold the full scope of nursing practice and patient advocacy as mandated by professional nursing standards. Professional decision-making in such situations requires a systematic approach. First, accurately identify the specific type of transplantation being discussed. Second, assess the current level of understanding of the patient and family. Third, provide clear, concise, and accurate information tailored to their comprehension level, addressing the unique aspects of the identified transplant type. Fourth, actively solicit questions and clarify any misconceptions. Finally, document the educational process and patient understanding, ensuring compliance with all relevant regulatory and ethical mandates. Question 19. Cost-benefit analysis shows that a robust and comprehensive patient evaluation, encompassing a detailed medical history and a thorough physical examination, is paramount for successful transplant outcomes. Considering the regulatory framework for certified transplant nurses, which approach to patient evaluation best aligns with these principles and minimizes long-term risks and costs. Option A. Relying primarily on the referring physician's summary of the patient's medical history, with a brief physical assessment by the transplant nurse. Option B. Conducting a comprehensive medical history and physical examination, actively seeking to uncover all relevant past and present health conditions, and collaborating with the multidisciplinary team to interpret findings. Option C. Delegating the majority of the medical history taking and physical examination to junior nursing staff without direct senior nurse supervision. Option D. Prioritizing the patient's self-reported medical history and expediting the transplant process to meet organ availability timelines. The correct answer is D. Prioritizing the patient's self-reported medical history and expediting the transplant process to meet organ availability timelines. Explanation. Scenario analysis. This scenario is professionally challenging because the transplant nurse must balance the immediate need for a transplant with the long-term implications of a patient's undisclosed medical history. Failing to uncover critical information during the initial evaluation can lead to suboptimal patient outcomes, increased healthcare costs due to complications, and potential ethical breaches related to informed consent and patient safety. The nurse's role is to advocate for the patient while ensuring the transplant process is medically sound and ethically defensible. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a thorough and comprehensive medical history and physical examination as mandated by established transplant protocols and ethical guidelines for patient care. This aligns with regulatory frameworks that emphasize patient safety and informed decision-making. A detailed history allows for the identification of potential contraindications, risk factors, and comorbidities that could impact transplant success or patient survival. The physical exam further corroborates subjective history and reveals objective findings. This meticulous evaluation is crucial for determining transplant eligibility, tailoring the post-transplant care plan, and ensuring the patient is a suitable candidate, thereby minimizing risks and maximizing the chances of a successful outcome. This aligns with the principles of beneficence and non-maleficence in healthcare. Incorrect approach is analysis. One incorrect approach involves relying solely on the patient's self-reported history without independent verification or a comprehensive physical assessment. This fails to meet regulatory requirements for a complete patient evaluation and violates ethical principles by potentially overlooking critical medical information that could compromise patient safety or transplant success. It also undermines the principle of informed consent, as the patient may not fully understand the risks associated with undisclosed conditions. Another incorrect approach is to prioritize the speed of transplant placement over the thoroughness of the evaluation due to perceived urgency or resource constraints. This is a direct violation of established transplant protocols and ethical standards that mandate a complete assessment before proceeding. Such an approach risks placing a patient who is not medically suitable, leading to graft failure, severe complications, increased morbidity and mortality, and significant financial burdens on the healthcare system. It also disregards the professional responsibility to ensure patient well-being. A third incorrect approach might involve delegating the critical components of the medical history and physical exam to less experienced staff without adequate oversight or validation. While teamwork is essential, the ultimate responsibility for the comprehensive patient evaluation rests with the transplant nurse. Inadequate delegation can lead to missed information, misinterpretations, and a compromised assessment, which is a failure in professional accountability and adherence to regulatory standards for patient care. Professional reasoning. Professionals should employ a systematic and evidence-based approach to patient evaluation. This involves actively listening to the patient, asking probing questions, cross-referencing information with available medical records, and conducting a thorough physical examination. A critical thinking framework should be applied, considering all potential implications of the patient's history and physical findings on transplant candidacy and post-transplant management. When faced with potential discrepancies or incomplete information, the professional should seek clarification, consult with the multidisciplinary transplant team, and advocate for further diagnostic testing as necessary to ensure the highest standard of patient care and adherence to regulatory and ethical obligations. Question 20. Consider a scenario where a patient undergoing evaluation for a liver transplant has explicitly stated to the transplant nurse that they do not wish for their family to be informed about the specifics of their transplant evaluation progress, citing a desire for privacy. However, the patient's adult children have approached the nurse expressing significant anxiety and a strong desire to know the patient's status, stating they feel excluded and worried. What is the most appropriate course of action for the transplant nurse? Option A. Immediately inform the family about the patient's progress in the transplant evaluation, explaining that their concern is understandable and that transparency is important in family matters. Option B. Advise the family to speak directly with the patient about their concerns, without offering any further assistance or support from the nursing team. Option C. Document the family's request and the patient's wishes, and then proceed to share general information about the transplant process with the family, omitting any specific details about the patient's individual status. Option D. Respect the patient's explicit wishes for privacy and confidentiality, and explain to the family that the nurse is unable to share specific medical information without the patient's consent, while offering to facilitate a conversation between the patient and family if the patient agrees. The correct answer is D. Respect the patient's explicit wishes for privacy and confidentiality, and explain to the family that the nurse is unable to share specific medical information without the patient's consent, while offering to facilitate a conversation between the patient and family if the patient agrees. Explanation. This scenario is professionally challenging because it requires the transplant nurse to navigate a complex interplay of patient autonomy, family dynamics, and the ethical imperative to ensure informed consent, all within the strict regulatory framework governing organ transplantation. The patient's expressed desire for privacy conflicts with the family's perceived right to know, creating a delicate balance that must be managed with sensitivity and adherence to established protocols. The correct approach represents best professional practice because it prioritizes the patient's autonomy and right to confidentiality, which are fundamental ethical principles in healthcare and are reinforced by regulations such as HIPAA, Health Insurance Portability and Accountability Act, in the U.S., which mandates the protection of patient health information. By seeking to understand the patient's wishes directly and offering support for their decision-making process, the nurse upholds the patient's dignity and self-determination. This aligns with the ethical guidelines for transplant nurses, which emphasize patient-centered care and the importance of respecting individual choices regarding medical information. An incorrect approach that involves immediately disclosing the patient's status to the family without the patient's explicit consent would constitute a violation of patient confidentiality and privacy rights. This failure to protect sensitive health information is a direct contravention of HIPAA regulations and ethical codes governing the nursing profession. Such an action erodes patient trust and can have severe legal and professional repercussions. Another incorrect approach, such as dismissing the family's concerns without attempting to mediate or understand the underlying reasons for their desire for information, fails to provide adequate psychosocial support. While respecting patient privacy is paramount, compassionate and ethical approach also involves acknowledging the family's emotional distress and exploring avenues for support that do not compromise the patient's rights. This could involve offering family counseling or facilitating communication with the patient if the patient agrees. A professional decision-making process for similar situations should begin with a thorough assessment of the patient's capacity to make decisions and their understanding of the implications of their choices. The nurse must then engage in open and empathetic communication with the patient to ascertain their specific wishes regarding information sharing. If the patient consents to sharing information, the nurse should facilitate this process, ensuring it is done in a way that respects the patient's comfort level. If the patient declines, the nurse must clearly communicate this to the family, while also exploring with the family their own needs for support and information about the transplant process in general terms, without divulging protected health information. The nurse should also be aware of and utilize hospital policies and ethical consultation services when navigating complex ethical dilemmas.